This is something that a lot of women and some men have to deal with, and it's basically torn or stretched ear piercings. So there's a lot of women who find that they have great looking ears and they love their earlobes and they love their ear rings, and one day they wear a hoop and something gets caught on it and ouch, it stretches or even tears the earlobe. I've had patients say that that's happened to them many, many times. I've heard that story. I've also heard stories of earrings that dogs and pets accidentally somehow get caught in and pull on. Young children do that as well. And so one of the things that we do quite commonly at YPS is we treat people who have torn earlobes or stretched earlobes due to ear piercings that have gone awry. So let's talk about some easy solutions. Well, the easiest thing is if you've got a torn earlobe or a stretched earlobe, and basically a torn earlobe is an earlobe where the actual piercing has torn all the way through, so you literally can't put a piercing in it because it's just a hole there. It's actually a tear, not a hole. A stretched ear piercing is one where the hole has stretched out quite a bit just because of, once again, it could have been partially torn or it could be the weight of earrings over many, many years causing that ear piercing to get bigger and bigger. In those types of situations, some people say, well, geez, I wore a diamond stud and it actually fell out because the hole is so big, it was much bigger than my actual earring. Well, this is one solution that's a temporary fix. It's called Lobe Wonder Patches. So if you've got a torn or stretched earlobe and you don't have time to get it fixed yet, but you want to wear a nice earring, this is an adherent patch. It's kind of like Scotch tape, but it adheres much better, that you put on the back of your earlobe, and it's nice and firm, so you can actually put the actual earring, the needle part of the sharp part of the earring through the actual Lobe Wonder patch. And because the Lobe Wonder patch attaches to the whole back of your earlobe, it helps to hold things in place. In addition, even if you haven't torn your earlobe, if it's stretched and you find that the ear piercing isn't that good and you're worried about the earlobe falling or the ear ring falling through the piercing like a diamond stud, well, you can put a little hole through that Lobe Wonder with the earring and it will stay in place because it's the tiny hole, not the bigger hole that you have. I hope that makes sense, but basically it's a patch you put on the back of the ear that can stabilize an earring, whether it's torn or whether it's stretched. It really can help. And it's very inexpensive. You can see there on this one it was 60 patches for less than $5. And you can find this on Amazon.com. Some, I think, drugstores have it as well. But if you are looking to permanently fix your stretched or torn earlobe, then we can fix that in office doing surgery. And this is a very minor operation that we do in the office where basically we remove or we cut out the elongated or torn piercing and suture it back together. Now some people say, Dr. Youn, why can't you just take a stitch? I've got a long piercing. Can't you just put stitches in there? Why do you got to actually cut the piercing out? Well, you cannot suture together skin to skin, okay? Because if we just put two sutures in that span then the length of that torn piercing and we take them out at a week, nothing's going to happen. That skin's just going to stay torn. And the reason why is because if you stitch skin to skin, it doesn't matter how long it's stuck together there with sutures, it's not going to adhere to each other. It's as if you take my hands and you suture my hands together for a week. When you take those stitches out, my hands aren't going to be fused together. They're just going to separate because the skin's not going to fuse together. Same thing with these piercings. So we actually have to get raw surface to raw surface, and we do that by actually cutting the piercing out. We do that under a local anesthetic. So you come into the office, you sign the paperwork, you take some pictures, and then inject some anesthetic solution into the earlobe. Just a couple little pokes is usually all it needs. That will numb the earlobe up, and then I gently cut out the piercing itself and suture it back together. You do get a permanent scar after this. That's the big negative with it. The scar is probably going to be a bit longer than the actual piercing or torn piercing. You let that heal. Well, actually, we put stitches in. Those stitches will come out after about a week or so. People don't typically need pain pills or anything like that. It heals very quickly, like literally as easy as taking a mole off of somebody. So you come back at about a week. We take your stitches out at that time. Watch out for any signs of infection or anything like that. After those sutures are out, you want to wait about 6 to 8 weeks before you re-pierce your ear. Now that scar in the earlobe is going to end up, when it's all completely healed, about 80 to 85% as strong as the normal skin around it. So what you don't want to do is you don't want to re-pierce the ear right in that scar, because you have a much higher risk that that piercing is going to tear again. So what you want to do is wait those 6 to 8 weeks and then pierce next to the scar. And if you're going to a place like a Claire's or someplace like that where the person doing it may not have a lot of experience with it, one thing that I recommend for you to do is to literally take a marker and mark a dot where you want the piercing at, and make sure that piercing, once again, is next to the scar, not in it. And that way, hopefully, you can avoid coming home, looking in the mirror and saying, oh my gosh, they pierced right into my old scar. That's not going to be very good for you. So the procedure itself, if you do one side, can take literally 15 minutes. If you do two sides, it may take a half hour. It's just done under a local anesthetic, no pain pills afterwards, very simple, and then you come back to have the stitches out a week later. Unfortunately, insurance does not pay for this type of a procedure. It is unfortunately considered a cosmetic procedure that is a cash pay. And we can talk about the cost of surgery. We'll give you that information at the end of the pre-consultation course. Well, I hope this has been helpful for you. If you have a torn or stretched ear piercing, you're not alone. Millions of people have it. Very simple fix. You can do a quick fix with the Lobe Wonder patches, and that can work for as long as you need it to work. Or if you want to get it completely fixed up, come on in the office and we can do it under a local anesthetic. Very, very straightforward. Thank you for watching.